Sisuluma, Lillian Ngoyi, among others. When we return, we'll continue with our coverage of the vaccine rollout, but we'll do that right now. And joining us is Avanti Governor Bester, and Avanti is a chairperson of the Medical Technology Industry Association. And we want to find out how technology actually contributes to a successful vaccine injection campaign. Thank you so much for your time this afternoon and for joining us. Now, when we talk about the role of medical technology in the rollout of the vaccination process, what exactly are we talking about? What are the elements that include medical technology?
Thank you, and thanks for having me. So in short, we use quite a few medical technologies in the vaccination administration. To start, basically, of course, the vaccinator needing full PPE, and we've spoken quite a bit about PPE over the last few months, including the gloves, etc., and masks that will be needed. Apart from that, for the vaccination itself, you do need a suitable syringe and needle for the actual administration. Thereafter, we get things like the needle boxes that you need to put away your sharps safely, and you'd also need things like cotton swabs for the vaccinators to prepare the vaccination site. So actually, besides just the vaccine, you do need a lot of medical technologies to assist in the process for a successful vaccination to be administered.
There are a lot of moving parts there. Do we have enough stock provision for the entire nation?
So, good question. I think over the last few months, we've managed to get a credible and adequate supply of PPE in the country. The focus now for our industry is to make sure that we have the other elements in place as well, such as I mentioned, the sharps boxes, and more importantly, the needles and syringes that need to actually be used for administration. We are aware that there's massive global demand for these vaccine technologies, so we do need to be on top of this one this time.
Are we importing, or is a lot of the medical technology also manufactured here in South Africa?
Unfortunately, with the needles and syringes, we do import the majority of products required. And again, this puts us at a bit of a back foot. We are looking at local manufacturing capabilities and capacities to ramp these up in some way. But at the moment, we have to import the administrative devices for the vaccine rollout.
And how has your sector been affected by the coronavirus and the lockdown processes?
So our sector has been significantly affected in terms of the decrease in certain medical activities in the country. For sure, if we looked at elective surgeries in our hospitals, those have decreased quite a bit, as well as the ability of patients to have certain tests done that are not deemed as essential. Our sector has taken quite a knock in those areas, as with all medical companies within the industry.
And what is it going to take to recover? Because obviously a reduction in the number of procedures that are being conducted is also a reduction in the revenue that the sector can actually generate and collect. How much time do you believe you need in order to get back onto your feet?
I think various scenarios have been played out onto how we get back onto our feet as an industry. We have received some assistance from governments in this regard. We are lucky to be able to provide some of the equipment necessary for the pandemic as well as the vaccine rollout. But I do think it's going to be some time for our sector to get back into the hospitals. As you know, elective surgeries are still restricted. Patients are still not required to go for essential required to go for essential medical testing, but not those that they may not deem as essential. So we are seeing a bit of time required to get back to where we used to be. When patients feel safe enough to enter the laboratories and enter the hospitals, perhaps then we'll see our sector actually getting back into a good economic way.
The provision of medical technology, is that put out to a tender process, or is it also streamlined through government?
So I think we've been administering vaccinations in this country for many, many years. So there is a tender process in place for these administrative devices. So we are comfortable with the fact that with the tender process that will ensue with the vaccination procurement, that this will follow that process. As I said, we have done vaccinations for many, many years, and there is a wealth of experience around the rollout of vaccine technologies in our country.
You've also mentioned that you believe that those who are involved in medical technology should be considered as frontline workers to be getting the first round, the first phase of the vaccine. Tell us more about that.
So we have made recommendations for those of our personnel within our industry who work directly with COVID-facing facilities. So in our case, we're looking at those personnel who go into the hospitals, laboratory personnel who are exposed to COVID samples. So we are considering and have suggested that our industry and those personnel within our industry that are facing COVID patients or COVID samples do also fall within the phase out of the first phase of the vaccine rollout.
So, I mean, you're talking distributors here, you're talking manufacturers. If you could break down the different segments of the sector that you want to be included in this first phase.
For the first phase, as I mentioned, it's really just those personnel that go into the hospitals. So we do have personnel who enter hospital situations where they assist in critical surgeries, where there are laboratory personnel who work with COVID samples. So not necessarily in the distribution and manufacturing area at the moment, but certainly those who are the front line who do face COVID risks in the environment that they're expected to work in.
Well, we thank you so much for your time this afternoon and pointing out the fact that there's so many different factors that go into vaccination. It's not just the vaccine, but also other medical technology that actually facilitate the vaccine they're being given. That's Ms. Avanti Govender-Bester, chairperson of the Medical Technology Industry Association, talking to us there about medical technology and how that contributes to a successful